Hello everyone, happy Sunday. So today I want to revisit a topic that I've already done a video on, but I think it's crucially important, and it's about masks. I think at this point it's not really should you or shouldn't you, it's about what type of mask should you be wearing. So I know there's a lot out there on cloth masks and people trying to be fashionable, and that's fine. And really at this point I think it's just better to even have something on your face than not to. Social distancing is still crucial. I'm here in Florida, so there are a lot of factors here that I just wanted to discuss, everything from the heat and the weather to what type of masks. The governor just shut down all the bars again, certain beaches like in Miami-Dade County, they're closed. So I wanted to discuss masks in more particular detail, specifically 3-ply and KN95 or N95. So first of all, I just want to let you know that I do sell all these masks in my office. And what's more important too is just keep your immunity boosted. Please don't neglect that. At the end of the day, I do so much COVID testing, and I've tested myself several times, and luckily up till now I've been negative. Your immunity is what's key. Remember, viruses are particles. They're not living, so they're not going to die. But what happens is they enter your body, a living organism, an animal or a human, and they hijack the cell's machinery. And they use that machinery to replicate, just like cancer cells. And when they do replicate, that's when all chaos begins. So if you have a strong immune system to begin with, something that's robust, that is going to be of great benefit to you. I do a lot of IV immune therapy in my office. I do immune supplements. There's so many modalities that I have. And again, if you really need COVID testing, I do offer that in my practice as well. I just want to show you some of the things here. As far as masks, so there are some cheap masks and there are some really good masks. The one I have in my hand right here is a little cheaper. It's a little abrasive. It's not conducive to, the skin. And you want to also look at like stitching, the welding. You want to look at the comfort of the masks. These are latex free. These are comfort loops. So if you're going to be wearing them every day, and now we're going to have to be wearing things a lot more, you want to make sure that you're going to be comfortable with it. As a healthcare worker, PPE can be a little uncomfortable in the fact that we're wearing it all day and we get a lot of skin irritations, especially those who are really front line, who are working in the emergency room or who are in trauma and surgery and anesthesia and things like that. We have to be really careful. What I want to show you is the layers of a mask. I'm going to start with the 3-ply mask. So what I'm going to do is I'm going to basically cut the seams off to show you the layers of the mask. And you're going to be a little intrigued with this because I have a little demonstration for you. So this is a really high quality mask. All my masks are provided by Raw Solutions. They have a brand called MediEase, which I have discussed in previous videos, and they are very, very high quality. So here we have 3 layers of the masks. The first layer is going to be spun bound outer layer. I'm going to cut this part off as well. And this is going to repel moisture. This is made of polypropylene. Why should it repel moisture? Is because basically the viruses are transmitted through respiratory droplets, which are moisture droplets that come from our mouth and that come from our nose. So typically this is going to be a color, maybe perhaps a blue or a pink or just a white. Okay, so it's going to be very soft, but it's going to have the layer that's going to be able to not have the viruses or the virions penetrate, as well as bacteria and other particles such as pollen and allergen, haze, etc. The middle particle is melt blown. What does that mean? It is actually fireproof, and I'm going to do a little demonstration now. It's electrostatic, so it captures 0.3 microns or less, and as you know, virion particles are super tiny, so we don't want them to get past and into our mouth and our nose. It pulls to the layer, it adheres it so it sticks there. This is why it's also essential to make sure that you do change your masks every few hours, ideally. I know it's hard. I just want to show you, I'm going to show you in a little bit that I do sell all these masks, and it's worth the investment. Ideally, they should be changed every 4 to 6 hours, believe it or not. They are disposable. They're not meant to be used over and over again. This layer also has a BFE, which is the bacterial filtration efficacy, or bacterial and viral filtration efficacy. For example, if we look here, we have a 95%. There are going to be different grades. This is 99%. And then when I get to some other ones as well too, we're going to have these, and this is also 99%. What I want to show you is this middle layer is super important. So I'm going to just light a match and show you that this is fireproof. It's not catching on fire. It's just simply melting away. Look at that. Pretty fascinating, huh? So this might be a good idea also when we're talking about health care workers, frontline workers, such as firemen, etc. That would be safe for them to wear. The last layer is a spun-bound soft layer, and this layer is meant to absorb the moisture. For example, because we have this closest to our mouth and our nose, when we are breathing, we have condensation, etc. So it's going to absorb that. But again, this is why it's so important to basically make sure that you're changing your masks frequently. We also have KN95 masks. So what's the difference here? The difference is basically the seal on the mask. So when we talk about the KN95, and I do sell all this in my office, we have more of a cup-like formation, okay? We have a more pointed, where it can look like a duck's bill. These are usually more for high-risk patients. Now, a lot of patients people still do wear this. Provides a stronger seal. When you look at high quality, again, this is from Raw Solutions, you do see the KN95 that's engraved on it. The stitching is absolutely superb. It's so symmetrical. These are a little bit more expensive than the 3-ply, but in my office, I do sell all these. I have a 3-ply mask. We have the kids mask. It's very important for kids to wear masks that seal to their face. If they're wearing a mask that's too big, what's the point? Things are getting in and out. That is not safe for them. They might as well not be wearing anything. We have to make sure the comfort and the breathability is there as well. I did do an experiment with my pulse oximeter. One of the reasons a lot of people are adverse to wearing masks is they feel like their oxygenation level is going down, they can't breathe. I did an experiment where I wore these masks and checked my oxygen level, and it was totally normal. A normal pulse oximeter showing oxygen level should be about 92 to 98%, 99%, 100%. When I wore these masks and even double masked myself, wearing 2, I still had a pulse oximeter oxygen level of 99%. So that is not a reason not to wear a mask. So there's a lot of controversy as well. But I do sell all this in the office. Kids masks, 3-ply masks, as well as the KN95. I know a lot of you have bought it. Remember, please, social distancing is very, very important. Still practice that. Being in Florida, again, we have a lot of strict laws here. A lot of places are being shut down again. We don't want to go through this over and over again. So what can we do to serve the best interest of the public? We're all in this together. If you have any questions, please call me at 727-754-2936. I'm always here to answer your questions. I have all these supplies, all this stuff here in my office. If you need immune supplements, and if you need IV therapy, if you need masks, I am here for you guys. And just make sure you take care of yourself. Be mindful. Remember, humility, compassion, kindness. Even if you don't feel like you're sick, you could be an asymptomatic carrier. And you want to make sure that you are being very kind and aware to other people who might not be as fortunate as you, where their health is at risk. Perhaps someone who's taking care of an elderly patient, they go home. You don't want them to transmit it to them. Someone who has a child at home who has cancer. And also, we want businesses to stay open. As a business owner, running a practice, I've been fortunate to be able to stay open, but we want to enable and empower everybody. We have to keep a lid on COVID. We have to help each other so we can all get through this together. It is a difficult time. I totally understand that. But if we can all be on the same wavelength and just help each other out, we're going to get far. We can do this. So again, if you have any questions, please call me at 727-754-2936. I do have all these masks and everything else that you need, and I'm here for you.